subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. I have great pleasure in welcoming Dr. Shalin Dubey, who is a consultant general robotic and laparoscopic surgery at Apollo Hospitals in Navi Mumbai. He's an MBBS and Master of Surgery, fellow in laparoscopic colorectal surgery from South Korea, fellow in minimal access surgery, fellow in hepatobiliary and liver transplant surgery from South Korea, certified robotic surgeon, expert in laser surgery for piles, fistulas, and pilonidal sinus. Dr. Dubey has performed over 3,000 laparoscopic surgeries, including laparoscopic gall bladder, appendix, and hernia surgeries. He has performed a maximum number of robotic hernia surgeries in India and is a certified robotic surgeon. He has worked with hospitals like the Apollo, Hinduja, and Tata Memorial Hospital. Dr. Dubey has fellowships in laparoscopic colorectal surgery from a university hospital in South Korea. He has fellowship in advanced hepatobiliary and transplant surgery from Asan Medical Center, Seoul, in South Korea. He specializes in laser treatment of piles and fistula, including treatment of complex and recurrent piles and fistula. He has done advanced level training in robotic colorectal surgery. Welcome to Health Live at Seniors Today, Doctor. How are you?
Thank you for wonderful opening remarks, Mr. Maheshwari. I'm doing very well.
Doctor, even as before we get to speak with you on the topic that we are looking at, tell us how's the COVID situation, and what about this whole monkeypox threat that is there?
So COVID situation is completely under control, I would say. It has become like another viral illness. We must maintain all the precautions as much as we can, like wearing mask and maintaining the distance if possible. But the work otherwise is going on, the life is going on. I think so people have got vaccinated, fortunately, with 2 doses, which is now reduced the morbidity of the whole situation. So COVID, I would say, is under control. It's not gone completely, but it is under control. Well, monkeypox is a very new thing. And if I'm sure everybody knows that in a year or so, we get some or others, this sort of illnesses, which are viral illnesses. I'm sure that we will have answers for that also. Fortunately, it is not as, contaminating, as rapidly infectious as the COVID was. So I'm sure a lot of our population is not going to get affected by monkeypox, though it is a serious illness.
Yeah, it's just that, it's one on the back of the other, so many of these various funny sounding, illnesses that are affecting
us,
the world, right? But you are at one of the leading hospitals of the country, and Apollo, as you know, it's across the country, and you all do think that it is, even if it's not a thing of the past, but it is definitely under control.
You're talking about COVID? Yes, right. It is very much under control. I think so 2 or 3 important factors. One, of course, is vaccine. The third is like public education. Now public is aware that what they need to do and what they need to avoid, and the initial stigma or the initial fear which was associated with the disease is gone. So people, they get themselves checked quickly in case of symptoms. They come to the doctors quickly when they have symptoms. And of course, last but not the least, we have also understood the disease and the treatment. So it's very much under control, but it's not gone completely. I'm sure it's going to take a long time before it goes completely.
Right. So, Doctor, over to you. I think, the topic that we have on hand today is, the entire issue about what is general and laparoscopic and robotic surgery. And I would welcome you to make your opening remarks, and then we'll get on to questions about from our readers who are here. For those of you who are here, please put in your question on the chat box with your age and your gender so that Dr. Dubey could give a considered reply. But over to you. What we would like you to help us is understand what these two surgeries are all about, and that would help us.
Sure. Thank you, Mr. Maheshwari, and good evening, all the viewers. I would like to talk in very simple terms about what the surgery is all about. I'm sure you all must have heard about general surgery, laparoscopic surgery, and terms like robotic surgery. So the purpose of today's talk is just to get you acquainted with the whole types of surgeries and how it has changed in quite recent times for the benefit of all of us. So let me just briefly start with the surgery, why it is known as general surgery. Initially, to start off, if I'm sure a lot of you must have gone through or might have experienced the pain, the increased time of recovery, say after an open hernia surgery or an open pile surgery. It takes long time and a lot of dressings and a lot of time for people to get better, to get back to their life quickly. Then gradually, I think so, a lot of research or the gradual understanding has made us more aware about laparoscopic surgery. So we started thinking, how can we do better for our patients? How can we make them recover quick? How can we give them less pain? So the laparoscopic surgery is essentially otherwise known as minimal access surgery, actually. So what we do, instead of taking a big incision on the abdominal wall, on your abdomen, to say, suppose I'm doing a gallbladder surgery or a hernia surgery. So usually it was a big 10 to 12 centimeter incision through which you access the abdominal cavity and operate that area, which takes long time to heal, has issues of blood loss, issues of post-operative pain, long recovery time, a lot of issues. What do we do in laparoscopy? We make some small cuts, say 1 centimeter to 3 millimeter cuts, through which we introduce camera and we introduce our operating instruments inside. We just go to the target organ. How it helps us, it gives us much better vision inside the abdominal cavity as compared to open surgery. And how it helps you in getting recovered very, very quickly, because there is not a big incision, there is not much of blood loss, there is not much of trauma to the adjacent organ, there is not much of tissue handling, is what I can say. So the recovery becomes very quick, and the vision and the advanced instrumentation helps us to perform the surgery very safely. How it benefits to my patients, particularly to senior citizens, is I'm sure after a certain age, we don't remain as healthy as we are before. Our body takes some time to recover. Body takes some more time to heal. So in laparoscopic surgery, since you have taken a smaller incision, since you are not doing a lot of tissue handling, since there is not a lot of blood loss because your vision is wonderful and you have got advanced instrumentation, all that translates into a early recovery and less pain. So a lot of people who are not otherwise fit for conventional surgery because of fear of, say, blood loss, people who are on blood thinners, people who have got different medical problems, people who are diabetics in whom the wound takes long time to heal. Laparoscopy has come as a boon for all of them. So laparoscopy, we make small puncture holes. We put our camera through that, we put our operating instruments, and then we operate. We see the whole thing on a monitor attached to our camera system, and the whole surgery is performed. Now, coming to robotic surgery, it's really surprising to think why, when laparoscopy was working very well, why we again thought about doing something different and doing or thinking about doing a robotic surgery. How it is different? I get asked this question many times. Doc, we have come to you, we want to get operated by you, and you are saying that you are going to do a robotic surgery, so robot is going to operate. So let me clear some concepts of robotic surgery. Robotic surgery is nothing but an advanced way of doing, again, a minimal access surgery, a laparoscopic surgery. When the science advances, there are always places where you can do better than what you were doing before. There are always options of betterment. So we realized that when we do this laparoscopic surgery, there were some limitations. There were some limitations of instrument movement. There were some limitations of, we started thinking, why can't we do this surgery like an open surgery, but with the same vision, with same instrumentation, and without cutting the abdominal cavity. Here comes the robotic surgery. In robotic surgery, what happens that we have 3 sets of instruments. One which we call as robot proper. The second one is which is known as vision card, and the third one is which is known as surgeon card. So it has got 3 sets of equipments. We exactly make the same sort of small holes on the abdominal cavity. Suppose I have to do an hernia surgery, and previously I was doing a laparoscopic hernia surgery. So now I'll make the same incisions. I'll put a camera, but that camera will be mounted on a robotic arm. There will be a big machine which has got 4 arms. The central arm is for camera and 3 arms are for instrument. So I'll mount the camera, then I'll mount the instruments which I need. After mounting those things, I will go and sit on the surgeon console. As you have seen people playing video games. On the surgeon console, I'll go and sit, and I will immerse my head on a view box, which will have a complete control of the whole system with my hand movement. Okay. So it is so foolproof that the moment I take out my hand from that vision card, everything will get frozen on the patient card. So whatever I am doing on the surgeon card is going to get translated on the patient. Okay. My hand movements will get translated into those instrument movement without any delay of even milliseconds. It will be like as if I'm moving my hand like this, the instrument will move like this. So what we call, how it is different from laparoscopic surgery, the dexterity of or the control of the surgery becomes much more precise as compared to what it is in laparoscopic surgery. And that gives us a distinct edge when we are doing difficult surgeries, when we are operating in areas where you don't have a wonderful access, like in pelvic areas, like in cancer surgeries, like in difficult hernias. If I say as a general surgeon, a reoperated, a recurrent hernia, or a hernia with a big defect, I don't need to go in and cut the whole thing. I can still do it the same way. Now, because I have got an instrument which is much more precise. So 3 things are grossly important in robotic surgery as different from laparoscopic surgery. The precision is much more than what is in laparoscopic surgery. The range of movement is much more, because in laparoscopic surgery, we have got a rigid set of instruments which will move either in 90-degree up and 180-degree up and down, or a little lateral movement. But a robotic instrument is something like that, which will move like my hand is moving. It will have the same range of movement what my hand is. So for you, it gets translated into a minimal access surgery, which is more precise, which has got improved dexterity, and the vision is not only 10 times better vision, it is 10 times better high definition 3D vision. Actually, on the contrary to laparoscopic surgery, here I'm in control of everything. In laparoscopy, I'm still in a little bit control of what my junior is doing, or what my assistant is helping me with camera or with my assistant port instrument. But here, my camera, all my port instruments are all in my control. Nothing I have to be dependent on anybody else. It is all controlled by my hand movements or by my foot movement. So I can switch over the instruments. I can have a complete control of camera. I want to see this side, I will see this side. I want to go back, see the other side, I can go back, see the other side. So it's a wonderful thing. Actually, it's not something which is very new. It is something which is very much established in prosthetic surgeries, in kidney surgeries. And I have a wonderful experience in complicated hernia surgery with this robotics. And believe me, this is a surgery of future, because more and more of us wants to be very certain about the outcomes when we go ahead with the surgery. Gone are the old days when it was like, okay, doctor, whatever you decide, it's just going to be fine. But here we want to be very certain, not only you as a patient, but I as a surgeon want to be very certain about my outcomes. I need to know how many patients will be not able to convert from laparoscopy to open surgery. I need to be very clear in my planning that I should not be converting even a single patient from a minimal access to an open surgery. So robotics had given me that advantage. And going further with good 5G or other technologies, how it is going to get benefit other patients. People suppose wants to get operated by their hernia surgery and they are sitting in some other nearby city, or I'm sitting at Apollo Navi Mumbai. They want the surgery to be done by me. I'm sure we are going to have the technology, the lag with which we can reduce that lag. And I can sit here in Apollo Hospital with my team member over there in that other city, and I can still perform the same surgery with the same dexterity and the same precision. So science has got limitless possibilities, and it is going to make the surgery much more safer in more coming times, and the recovery is going to be wonderful. So this is about robotic surgery. I would like to even brief you about laser procedures. Laser procedures, dear friends, have changed the way we treat common problems like piles, fissures, and occasionally fistulas also. I'll talk about these only because I'm an expert of proctology about laser piles, fissures, and fistula. So what we used to do previously, we used to give anesthesia, cut that area, put the suture in that area. It was painful thing, takes long time for healing, multiple dressing, an avoidable experience, to tell you the truth. But that was only available that time. And come today's age, if I see a patient at a relatively early stage, all I need to do is under anesthesia, take a laser fiber, do a laser without any cut, without any need for dressings or elaborate repeated visits in the hospital, and patient is gradually better with this thing. So laser is almost like a painless treatment for piles and fissures, this thing, provided you come at a relatively early stage. Don't expect miracles if the disease is already complicated or has got advanced. For any disease, as we know, science can only help us to an extent if we come and see our doctor at an early stage. The problem with piles and fissures, which I've seen in my experience of medical practices, that many times we go to the so-called experts of piles, or we take home remedies, and there's no harm in taking any home remedies or any other advice. But you should realize very early that if the problem is not settling down, there is no need to wait and continue it for forever. So I would say that these advancements, laparoscopy is a very, very established thing. Robotics, I'm sure you must have understood the basics of that, and laser are going to change, and they're already changing the way we operate, the way you, my dear friends, proceed towards surgery and recovery after surgery. So that is all about laparoscopy, robotics, and laser procedures. If you have got any doubt in your mind or any queries, I'll be happy to answer.
Thank you very much, Dr. Dubey, for this brief but fairly detailed look at what this overview of what these two surgeries, what these various forms of surgeries are. Because there's somewhere, this thing about robotic, as you mentioned, that is it artificial intelligence? Is it, where does the doctor come in, et cetera, et cetera. So obviously, that's it's not a robotic surgery of that sense. There is a proper medical intervention that comes in. Doctor, we have a few questions that have come in. One is from Mr. Bharat Mehta, who says his wife, who's 62, was operated for gallbladder removal by laparoscopy surgery due to 7 stones in the gallbladder. Her weight has gone up after surgery. How to reduce weight?
Okay, can I answer that?
Yeah, please go ahead. Please go ahead. That's for you.
Okay, Mr. Mehta. Okay, good question. Let me tell you one thing very upright. Any surgery, a lot of them, I'm talking about general surgery. I've heard all my life that doc, my cesarean section or my gallbladder surgery or my this surgery, the weight has gone up, or I've got tummy which has come out. Believe me, it has got nothing to do with surgery, laparoscopy or open or anything, unless if somebody has undergone a very major surgery or this thing. But gallbladder surgery I'm talking about, or appendix surgery, or for a matter of fact, cesarean section. Any gain of weight is a reflection of how we are eating, are we exercising well, or what happens a lot many times I have seen that patients who have got gallbladder stones, the moment they eat something, they get pain. So because of that, their appetite goes down. They try to avoid eating. After the surgery, she might be just feeling wonderful to eat. So she might be eating a lot. So just look at those factors. Don't directly relate it to this as an outcome of surgery. She should be taking care of her diet and exercise. She will be just fine. It has got nothing to do with the gallbladder.
Right. Doctor, we have a question from Mr. Madhusudan Bhandarkar. He is 70 and he is from Mangalore. He says, can I have my right knee replaced through laparoscopic surgery? What will be the duration and the total cost?
Mr. Bhandarkar, again, thanks for asking this question. I'm happy that you people are aware about everything and are asking question about this. Even my own mother have undergone a bilateral knee replacement. I'm not an orthopedic surgeon, but I can tell you with my experience, as far as I know, there is nothing like a laparoscopic surgery in a knee replacement. You should be asking this question rather to an orthopedic expert. But nowadays, what people do is what is a robotic assisted planning for a knee replacement surgery, which tells the doctor very precisely how much of the implant and what sort of implant to be put. Again, that translates into relatively early recovery, smaller incisions, and less pain. But this question will have to be ideally asked by orthopedic expert, not by me. And recovery depends after any surgery on a lot of factors, not only on the type of the surgery, but it also depends on what are the patient's medical condition and obviously means how the surgery has been done. It's not only just the way of the surgery that anybody doing laparoscopic surgery or minimal access is going to be same outcome. It's dependent on a lot of factors.
Right. Thank you. We have a question from Lakshmi Vishwanath. Says, how late is too late? Is there, if there's no bleeding but occasional swelling and pain once in 4-5 months, especially when I eat out, can I ignore the piles problem and continue as usual?
Well, a scientific fact is that we humans, we don't notice regularly bleeding unless until it is a gross bleeding. So to just simplify your query, I would rather say that if you feel, doc, I don't have much problem, occasional bleeding, that's all. You get yourself checked by any good surgeon in your nearby area. Just let him do a local examination. He or she will be able to tell you that whether you need anything or whether you can just continue with your conservative management or medical management. And so, as I said, piles and fissures, just get yourself checked by a good expert at a right time. Otherwise, it's not a super emergency, and don't make it an emergency.
Right. Thank you. Doctor, we have a question that I've got by SMS. What is the price differential between a regular surgery and a robotic or a laparoscopy surgery?
Again, it is a very simplistic view of this thing. If we just say that the open surgery I would not even like to talk about open surgery. We don't do open surgery only, say for gallbladder or hernia, unless until it is something which is really, really complicated and you can't do anything about this thing. So let us talk about laparoscopy and robotics. The price difference is usually ranging from somewhere 70,000 to around 1 lakh rupees because the main reason is till date, the robotics was just part of one company who have invested in the whole robotics thing, and they had the patent and only they were doing it. But in coming 6 months, there are a lot of companies and a lot of other companies who have come up with this thing, new devices and this thing, new paraphernalia for treatment. So it's certainly going to reduce. It is certainly going to reduce. But as of now, the difference is somewhere between 70,000 to 1 lakh rupees between a laparoscopy and a robotic surgery.
Thank you. We have a question from Usha Jacob, who asks, a senior in the family had undergone conventional surgery for fissures about 20 years back. The anal passage has narrowed down post-surgery. This causes a lot of discomfort. Can it be rectified through surgery?
Yes, it can be. And again, 20 years back, our understanding about fissure and pile surgery was very, very different. And the surgery which was being done at that time, I would honestly say, was a sort of very mutilating and painful experience. It can be if there is no this thing and there is no need to do a redo or an open surgery. With laser treatment, she can, I'm sure, live a wonderful normal life. It can be done and very easily done, believe me.
Thank you. We have a question from Mr. Dilip Dalal, who asks, is there any relation between sporadic palpitation and heart attacks?
Well, Mr. Dalal, again, I'm not the right person. I'm a surgeon. If I get any palpitation, I'll rather go to a cardiologist. But yes, any palpitation might be a marker of arrhythmia. Arrhythmia is electric disturbances in your heart, this thing. So if somebody has palpitation, please go to a cardiologist. But yes, it is not always directly related to a heart attack. It is not immediately directly going to take you towards a heart attack. But if somebody has regular palpitation, all they need is a good ECG, a Holter monitoring, in the cardiologist's opinion. I will be not the right person to comment on that.
Right. Thank you. We have a question from Mr. Sumerchand Jain, who's 80. His question is, my gallbladder was removed about 12 years back. My acidity medicine is increasing continuously. Is there any way to get free or reduce the same?
Mr. Jain, gallbladder surgery is no, or gallbladder or gallstones are not the sole cause of acidity. There are multiple reasons for acidity. So acidity in science is classified into two parts. We call it ulcer dyspepsia. I'm sure you all must have heard about gastritis or gastric ulcer or a peptic ulcer syndrome. And the other one is non-ulcer dyspepsia. So, sir, you are 80 years of age. I'm sure that if you get yourself evaluated, you might find that there are a lot of other factors. The wall between the stomach and the esophagus, our food pipe, becomes lax with age. So whenever we eat, I'm sure you must be having that problem. You feel immediately full in your upper abdomen, and you feel like there is some sort of splash or a regurgitation of food or acid in your this thing. So there are a lot of other reasons apart from just gallbladder stone or gallbladder removal for acidity. Whether your medicine of acidity can be, and otherwise medications also. A lot of elderly people, they are on ecosprin because of cardiac condition, which is non-steroidal anti-inflammatory drug, which causes a lot of gastritis. Or people are on diabetic medications, which reduces the intestinal motility. So, sir, there are a lot of factors which might be contributing towards your acidity problem. If you think it is really, really a lot, better to have a consultation and SOS endoscopy done to understand it much better. But believe me, it has got nothing to do with your removal of the gallbladder. I'm sure it was done 20 years back, and there might be other factors which might be playing a role in that.
Right, thank you. We have a question from Mr. Suresh Ghate, who is 70. His question is, in case of heart surgery, angiography, angioplasty, wall replacement, etc., can that be carried out by robotic surgery?
Mr. Ghate, it is, you know, you will be amazed to know that when the robot was first made by this company, Da Vinci is the name of the company. They first made the robot. They actually made it for cardiac surgery, because that time the cardiac surgery was very, very fascinating, and it was done for cardiac surgery. So if I tell you the brief history about this thing, it didn't pick up very, very well. So the company was actually going into loss. And they had a gentleman, his name is Mr. Vatikutty. He is an Indian who was a big investor in technology. So these guys went to Mr. Vatikutty and asked him that what we can do with this. And Mr. Vatikutty said, okay, let me just try it with my doctor friends and we'll try it for urology. And they started it with urology. So the robotics was evolved and was made for cardiology, but somehow it didn't work very, very well for cardiology. But that was part of the bad news for you. But the good news for you is cardiology has also evolved a lot. That cardiology, a lot of things, you don't need any open surgery. A lot of things are nowadays not done by cardiothoracic surgeons, but a cardiologist. And they do a lot of minimal access procedure where you actually don't need any cuts or any this thing. So wall replacements or otherwise angioplasties are something which are anyways non-invasive procedures nowadays. But if you require a bypass, then there is minimal access bypass. But to my understanding, robotic has not got a lot of role in cardiac surgery.
Great. As you were speaking, Doctor, I was looking at the Vatikutty Foundation.
Yeah, Vatikutty Foundation is the foundation who have taken over and started the whole robotic program. Yeah, and I'm proud that 2 Indians were associated with the whole this thing, Mr. Vatikutty, and after that there was a big shot urologist who was again from South, who was a very famous urologist in US. He was a friend of Mr. Vatikutty, and he was the one to whom he went, and they started the whole thing.
Right. So Mr. Raj and Mrs. Padma Vatikutty and the Vatikutty Foundation. Amazing story, and thank you for, it's amazing that how, despite the fact that we don't hear too many great success stories about Indian progress in medical sciences abroad, but these are some stories that need to be told, and we should all feel proud of the way things are. Doctor, there's one more question that has come in again from on the SMS, and the question reads, Doctor, at what stage and which surgeries is a robotic surgery a more advisable thing than the regular surgery?
Well, a lot of factors honestly will answer this question, but just a simplistic view, if I tell you, robotic is very well established in prosthetic surgeries, which will a wonderful role in prostatic cancer surgeries, kidney surgeries, where again you want to conserve a part of the kidney in kidney cancer. Gone are the days when you take out the whole kidney. If you are detected with an early kidney cancer, then it's kidney cancer surgeries. Colorectal cancers, it has got a wonderful role, and people are doing it very routinely. Gynec oncology, gynec cancer surgery, it has got a wonderful role. And if I talk about general surgery, then a lot of complicated hernia surgeries or rectal prolapse surgeries, it has got a wonderful role. It helps us in giving us good outcome for our patients, provided we see them at right time and we plan it right.
Doctor, this person has asked another question, is that, Doctor, we are dependent on insurance, on medical insurance for given the high costs of surgeries. If we do go in for a robotic surgery, will these be cleared by the insurance company? Because the fact is that there's a cheaper option also available.
Yeah.
Very, very pertinent question, Doctor. I think, will these get cleared by the insurance companies?
Yeah, he's asked a very good question. Unfortunately, not all. And the problem here is that the insurance companies, as of now in India, they have cleared some urology procedures for robotic surgeries, but not all. So it is all about public education and public opinion. No company is going to shed a little more extra for the same surgery. We had the same resistance for even laser surgery. And initially when we switched over from open surgery to laparoscopic surgery, So, it is going to evolve, it is going to change when people are going to demand. No insurance company, in my opinion, should be saying to the patient or to the doctor that operate only this way. Yes, they have got this thing, understanding that doc, show us the data, or let us know the data that whether it is going to improve the outcome. So I'm sure they're waiting for data for a lot of this thing, but yes, they will be a little slow in coming to terms with sanctioning this. But I understand this apprehension about insurance clearing. As of now, not all insurance companies clear a lot of robotic procedures. That is the hitch. But I'm sure it will.
So which means that if one is advised about robotic surgery, then you must check with your insurance company whether it will be allowed, because it may not be a given that it could be a cashless surgery or whatever.
No. So there are so many times we have to explain the insurance company that this is how it is going to benefit my patient. And I'm sure it is just about time that they will understand that, okay, this is a procedure where the patient is getting benefited, and people will make even corporations understand. So I think so it is going to become a norm not later, very sooner, let me tell you.
Thank you very much, Dr. Dubey, for this session. I know you have a surgery that you have to get into. So, friends, Dr. Shalin Dubey has joined us from the hospital, and he has a surgery in the next 10 minutes. So we are going to let him go. And thank you very much, and all the best for your surgery. And I'm sure, as with various surgeries. So tell me something, Doctor, since we have 2 minutes, what is going on in your mind before you go into a surgery? How do you, and then you obviously know the case and you know what the requirements are, but talk to us about the mind of a surgeon.
So the mind of the surgeon, Mr. Maheshwari, gets all the work is done before my patient is admitted. I know that what difficulties or what problems or how smooth I think so this good surgery is. So all the work actually is done, what you say, at the time of, before the time of admission. At the time of the surgery, just before starting the surgery, actually, honestly, I just pray to God, and I pray every morning that I know I'm a human being with which the expectation is to give a God-like outcome. So I just pray to God that be with me and try to see that everything goes well, nothing else. And after that, we are just on our way. We are trained like that we don't think a lot. We just go with the process and we follow that.
Absolutely. So, to you, doctor, and to the various surgeons in the world, all the very best, and may God and the forces be with you. Thank you very much for taking time on this Saturday afternoon. And as we know, just before this a surgery that you have, Dr. Shalin Dubey, and to Apollo Hospitals, thank you very much for facilitating this. And as always, we'll be back next week, that is next Saturday, the 13th, for another session of Health Live at Seniors Today. And to all of you here, goodbye. As you know that we are working on the next issue of Seniors Today, which will be out on August 15th. And it is, I must tell you, it's a special Independence Day, 75 years of independence feature that we have. We are also starting with our Seniors Have Talent on August 17th, which is a Wednesday. So please join us for that as well.
Subscribe now and press the bell icon. Never miss an update.